there is room for de-escalation of surgery, definitely in the axillary management. We're doing less and less axillary management because the radiation treatment has been very effective. And so we will use to do full dissections to remove all of the lymph nodes, just like back in the day we used to do a full mastectomy, removing the muscle as well, because we thought that more we cut, better control disease we have. Then we learned that this is a systemic disease. It's not as much as you cut, but it's the systemic control of the disease. Then we use chemotherapy, we use radiation to help us. So the surgery is going toward the de-escalation. But in terms of options, there is always two options. Either you have to remove the cancer. Either you do with a small surgery, which is the lumpectomy, or you do with the big surgery, which is the mastectomy. It doesn't change in survival, and it doesn't change on local control, as long as the small surgery is associated with the radiation. So options are always two. Patient asks, who is the candidate for a small surgery, right? Less pain. You have to have a small cancer for that. So it's very important, the early detection. Again, the smaller the cancer is, the better option we have for surgery. We can save the breast if the cancer is not very large. And also, on that page, we could use medication to make a breast conservation happen. We can use chemotherapy before surgery to shrink the cancer, make it as small as possible, and then we can save the breast. So we have many options. We're definitely moving toward sparing more surgical management and be a little bit more conservative.